There's a statewide effort to connect youth with early psychosis care, and here with more information are Dr. Vinod Srihari, Julienne, Giard, and Dr. Stephanie Bozak. Thank you all for being here. We appreciate your time.
Thank you.
So what is Mindmap for folks who might not be familiar?
Mindmap is the name of a statewide effort to bring young people with psychosis into care as soon as possible.
And Julienne, why is a campaign like this so important?
Well, as we know, with all chronic conditions, it's really important to have early intervention. It really brings about good long-term outcomes. For psychosis in the greater New Haven area a few years ago, we cut the time to treatment by half. And so we know this works, and we really want to spread it statewide.
So what is psychosis, and what are some of the signs and symptoms to look out for?
Well, it can be confusing. A lot of people don't know what psychosis is, but it's a collection of symptoms that may indicate a diagnosis of schizophrenia. So it could be things like a loved one withdrawing from interactions, may seem depressed, may not be taking care of themselves as much. They may talk about seeing or hearing things that other people don't. So those are some of the main symptoms.
And Dr. Bozak, adolescence is already a time of immense change, so I imagine a first episode of psychosis can be overwhelming for both the child and the family.
Absolutely. Adolescence is such a time of challenge. You're dealing with school, family dynamics, and all of the pressures that just come with adolescence. And we at the Department of Children and Families really understand the unique challenges and why it's important to seek help immediately if you're starting to see these signs and symptoms.
And are there long-term benefits of early detection and treatment?
Absolutely. Early detection and treatment really helps with being able to live a fulfilling life. It helps with remaining connected and being able to continue on with your life in a meaningful way.
And Julienne, what role does the community play in supporting the goals of Mindmap?
Well, we really want the community to, people that they come into contact with that might have these symptoms to call the main number. We have this statewide number. We have treatment centers across the state for people with or without insurance to get the care that they need. So this could be college counselors, educators, family members, please call. And it takes all of us to have these kinds of conversations to normalize mental health conditions and access to care and to reduce the stigma.
Which is why collaborations like this are so important to get the word out.
Absolutely. We're so grateful for this collaboration with the two agencies and really 13 mental health agencies across the state and many other clinics. And the message is fairly simple. Treatment works. The earlier, the better.
Well, thank you all so much for being here. This is an incredibly important conversation, especially to help families feel like they're not alone in an early diagnosis or if they might be seeing some of those signs and symptoms and want to find ways to help. So thank you.
Thank you.